Rhode Island has 8 federally qualified health centers. They're throughout the state. They have more than 30 primary care sites. And they provide care, not only primary care, but behavioral health and oral health care to more than 190,000 Rhode Islanders. So they are a very significant portion of healthcare delivery in Rhode Island.
A lot of folks don't realize this, but our community health centers have been here for 50 years, and they've been delivering great quality care.
They started as very small organizations that were established in their community by community activists who were committed to assuring that families and children particularly would have access to quality health care.
When they talk to you, they're not just asking about your health. They want to know, are you safe? Right? They want to make sure that you have access to heat and that you have housing that is predictable and reliable. They want to make sure that your kids are in school, and if they're having any issues. There's a wide range of things that they're trying to make sure they understand, so if they see a gap or if they see a need, they can fill it and fill it quickly.
Some years ago, the state of Rhode Island was interested in moving more from a fee-for-service model to a managed care model. And the community health centers were astute enough to understand that they needed to be part of that process. They came together and decided to found Neighborhood Health Plan of Rhode Island.
Rhode Island is considered one of the top areas for healthcare in the country. That doesn't happen by accident. That happens because of the relationship that Neighborhood and these community health centers do and work together every day. The global pandemic obviously has created significant challenges for everybody in lots of different ways. But what it has done, it has underlined the true value of the community health centers.
Certainly we know that Providence, Central Falls, Woonsocket, Pawtucket all have had significantly higher rates of infection from COVID than other places in the state have. And the health centers have been able to work with those communities and help to make sure that they have access to care and have access to testing in a way that is culturally and linguistically appropriate and supportive of those communities.
And they are there to interact with folks, to answer very difficult questions, to understand what they need to look for and how do they protect their families. So it's not just about delivering great care, it's about that relationship that they build with people.
I think it is their commitment to their community. It's their commitment to understanding that there are new and different ways of doing things that can be very effective that allowed them to be able to be that agile in making this effort. They continue to see patients. They continue to test patients. Every single health center in the state had a testing operation during the beginning of the COVID crisis and continue to do that today. When we decided to talk about how we would do Health Center Week this year, we normally have a celebration at one of the health centers. We ask the health centers to identify a staff person who has gone above and beyond during the year. We always call them healthcare heroes. But this year, when I discussed this with the health centers and with their CEOs, the one prevalent theme was they are all heroes. And so we should recognize all of them.
So I consider the staff at community health centers to be healthcare heroes every day of the year, regardless of whether we have a pandemic.
They just have been incredibly, incredibly committed, and I hear it. I hear it in the voices of the clinical leaders in the health centers. I can hear how weary they are, but I also can hear how proud they are of all of their staff and the work that they've been able to do.
Community health centers as organizations have been tremendous in moving the health care system forward in the state. But I think oftentimes people forget that there are leaders within those community health centers. There are CEOs, there are doctors, there are nurses, and their frontline staff. They're all making contributions that oftentimes go unnoticed or they don't really jump out at you. But when you look at them collectively, they have shaped Rhode Island's healthcare system in a way that I think is unique, and I think propels us into the future to where we're going to continue to lead the country.
They are a place of trust and safety, and I think that in times when we are so off kilter, all of us, and particularly those in those communities, I think it's critical to be able to have a place to go where you know that you can trust that the care will be good and that you know that you're safe when you go there. I could not be prouder to be associated with every staff member of a community health center in Rhode Island.
I think a thank you needs to go out to the leadership in the community health centers for their great work and their vision as to what they started looking like 50 years ago and where they are today and where I expect them to be 50 years from now.